Hello, everyone, and welcome to CE Institute. My name is Selena Belisle, and I am the instructor of myofascial release here at the school, one of several. And I'm also the founder of the school as well. And today I'm going to show you a palming technique that we used on the hip of a client who had been in a very bad motorcycle crash. He has severe road rash, and his tissue is now pliable and his hip is functional because of repeated body work and techniques such as the palming technique in and around that road rash. Now, you should not practice myofascial release unless you're already a licensed healthcare provider, preferably somebody like a licensed massage therapist or physical therapist. There are some rudimentary training needs that need to be learned prior to practicing more advanced body work. You can certainly register for some of our training after you've completed that rudimentary training. This is continuing education for people who are already licensed to practice. Now, under the free training tab here on our website, you can just click a category, select category. I'm going to scroll down to myofascial release, and you'll be able to find more training here on our website at ceinstitute.com if you would like to learn more about myofascial release once you're licensed to practice it. So without further ado, let me show you what the palming technique looks like in myofascial bodywork. Now we're going to do some palming technique on a road rash. This is around the client's hip. And you can see all the road rash. I'm going to try and stay away from the blue discolored area. That would be ruptured capillaries. Okay, and you can see I'm just placing my palm and I'm working posteriorly towards the client's maybe sacrum and glute muscles. Moving the camera back a little bit here for you so you can get a better angle. And notice how long that stretches, and I'm only stretching like 4 inches. I'm doing this dry without lotion. And I'm just trying to stretch out the fascia around this road rash where I feel that there's some restriction. And I determined that from clock technique. And I also determined the restriction when I was practicing myofascial skin rolling over this. So now I'm moving into a nice palming technique, which is quite deep, not working over the blue area, which is, he has some capillary leakage from just, massive damaged soft tissue from the motorcycle accident. And this can be pretty intense. It's a big stretch, and that is palming.